guys, so this is the Chapter 5 key points video for OT101, and Chapter 5 covers the diseases that occur in the eye and ears. So let's check this out. So we start with the four main refractive errors. Those four are hyperopia, which is farsightedness, and that's where the light is focused behind the retina. Hyperopia typically occurs when the eyeball is abnormally short when it's measured from front to back. Myopia is nearsightedness, and that causes blurred vision. It occurs when the eyeball is abnormally long when it's measured from front to back. Astigmatism is the third main refractive error, and it is an irregular focusing of the light rays. The front of the cornea in astigmatism may be more of an egg shape than it is spherical like it's supposed to be. Thereby it causes light rays to be unevenly or diffusely focused across the retina. And then the last main refractive error is presbyopia, and that is the loss of elasticity in the lens. And these four main refractive errors may have a genetic link to them. So if your parent is farsighted or nearsighted, then you may also be farsighted or nearsighted. It's not necessarily a genetic thing, but they may have a genetic link. Treatment, though, is pretty easy for these refractive errors. It usually just requires a visit to the eye doctor and then some glasses or some contacts. Nystagmus and strabismus are the next two things that we'll talk about. So nystagmus is an involuntary, repetitive, rhythmic movement of one or both eyes. And this can be a congenital, so from birth condition, or an acquired condition, so something that develops throughout somebody's lifetime. Strabismus is the failure of the eyes to look in the same direction at the same time, which primarily occurs because of weakness in the nerves stimulating the muscles that control the positions of the eyes. So sometimes this is more commonly referred to as cross-eyed or wall-eyed. So basically one eye is one direction and the other eye is another direction, or one may be straight and one may be looking outward or inward. Esotropia, which is strabismus, usually develops in infancy or early childhood. It may be associated with amblyopia. And amblyopia is reversible until the visual pathways develop at about 7 or 8 years of age. So that's why it's really important to get treatment early for these kids who have strabismus or esotropia, because until they hit that 7 or 8-year-old mark, they can actually reverse this condition. So cataracts and glaucoma. Cataract is an opacification of the natural lens of the eye, so it becomes cloudy. Usually from aging. It happens a lot when people get older. Patients will report changes in visual acuity or they may report a glare, and they should be given the first available appointment for an ophthalmic examination. So if they are reporting symptoms of a cataract, then you want to try to get them into the doctor as quickly as possible so that we can assess the cataracts, and then the doctor can make a determination as to whether or not it's appropriate to go forward with removing them. The patient may report poor night vision, a yellowing or fading of colors, or they could also report a loss of the brightness of colors. So they may be able to see colors, they just won't be as bright as they remember them being previously. Cataracts may be congenital, again from birth, or they could also sometimes be caused by trauma or systemic diseases, and they often will have a familial occurrence. So if, again, unfortunately, if your parents or grandparents have cataracts, if you have a history of family with cataracts, you're probably going to end up with them too. Glaucoma is damage to the optic nerve in the presence of an elevated intraocular pressure. Glaucoma is a major cause of blindness, and the risk factors for glaucoma include an age of older than 60 years, previous history of nearsightedness, blood relatives that have glaucoma, and then people of African American descent typically are diagnosed with glaucoma more frequently. By the time the symptoms of glaucoma appear, unfortunately, the damage has already occurred, and glaucoma is best treated by best detected by periodic routine ophthalmic exams. So the best way to detect glaucoma and prevent further damage is to have those annual eye exams. Macular degeneration is a progressive deterioration or breakdown of the macula of the retina. This condition is usually painless. It develops slowly, so people don't necessarily know that they have an eye condition going on. It's not like it is with cataracts or with glaucoma, where they can sense these changes a little bit more quickly. It develops very slowly. It does not affect the peripheral vision, though. It only affects the center vision. Macular degeneration is often considered to be age-related, and therefore the mature adult is encouraged to have regular ophthalmic examinations. So basically with macular degeneration, what happens is it puts a big black spot in the middle of everything they're looking at. So the patient is able to retain their peripheral vision. They can see things on the outskirts of their field of vision, but there's a big black dot in the middle of their field of vision that occludes anything that would be right in front of them. Symptoms for macular degeneration are mild distortion of central vision, seeing wavy lines or opaque spots in the visual field. Age, genetic factors, and prolonged exposure to bright lights are all causative factors. A thorough exam is needed for a diagnosis of macular degeneration, and it's a pretty thorough exam. I happen to have a grandfather with macular degeneration, and I have accompanied him on the doctor's appointments to the ophthalmologist for his treatment, and the exams that he has had to have done are pretty intense. So it's a pretty thorough exam. There is no definitive medical cure known. They have developed some medications that can be injected directly into the eye that can slow the progression of macular degeneration, but they cannot reverse any of the damage that has already been done. Next, we have diabetic retinopathy. It is a pathologic alteration of the retinal blood vessels and the pathologic proliferation of retinal vessels. It's characterized by microaneurysm, hemorrhages, dilation of retinal veins, macular edema, which is swelling, and formation of abnormal vessels. Typically, it's going to occur about 8 to 10 years after the onset of diabetes mellitus. Diabetes causes poor circulation in the retinal blood vessels, and that may cause a leakage of exudate into the retina. So it's no big secret that diabetes causes a whole host of problems, and this is just unfortunately one of the ones that shows up a little bit later. Sometimes fragile new blood vessels, and that's called neovascularization, can grow and lead to the leakage of blood into the vitreous humor, and that's how this diabetic retinopathy thing happens. So maintaining tight blood glucose control can prevent the onset of diabetic retinopathy, and it can also improve any existing retinopathies that may be present as well. Moving on to the ears, hearing loss. There's a couple of different types of deafness that you should be aware of. The first is conductive deafness, and that is caused by an impairment of the eardrum or bones in the middle ear. And those are the bones that conduct sound waves to the cochlea in the inner ear. The second is sensorineural deafness or nerve deafness, and that's going to result from the impairment of the cochlea or the auditory nerve. Central deafness is where the central nervous system cannot interpret impulses due to a cerebrovascular accident, or like a stroke, or a brain tumor. Cochlear implants may be needed if any of these types of deafness are present. Some things to note here about cochlear implants. These cochlear implant systems are very, very complex, and they include an electroarray, a receiver, a speech processor, transmitting coil, and a microphone. So they have a whole host of components and equipment that come along with the cochlear implants. The electrode array is actually placed surgically within the cochlea, and then the receiver is implanted and fixed to the skull behind the mastoid bone. So you'll see them, people who have cochlear implants, you'll see the little very small box-looking thing that is actually screwed to the bone behind their ear. The cochlear implants do not actually restore normal hearing. However, they can improve a deaf person's functioning in a hearing world. So that's a big big positive from having no functioning to an improvement in functioning is worth the process of obtaining the cochlear implant for many deaf patients. Candidates for the implants are selected very carefully, and they should have a severe to profound bilateral sensorineural hearing loss and be older than 2 years of age, which means they have to be deaf in both ears, have to be older than 2, and it has to be sensorineural deafness or nerve deafness. Otitis is the next condition, and it is inflammation of the ear. Now, there are a couple of different types that you need to know about. Inflammation of the external ear canal is called otitis externa. The characteristics of otitis externa are severe pain, a red or swollen ear canal, hearing loss, fever, and pruritus. Those are the very common symptoms that go along with otitis externa. An accumulation of cerumen or wax in the ear canal, when mixed with water, acts as a culture medium for bacteria or fungi. So here's the thing with bacteria. They love to live in damp, dark, and warm places. And your ear canal is warm and it is dark, and if you put water in there, then it will be damp also. So you just give it like kind of a bacteria, kind of like this breeding ground for to grow and flourish and thrive if you have this impacted wax stuff in there with it. So it's good to keep your ears cleaned out. Individuals that report pain in the ear accompanied by drainage should receive prompt attention. You don't want to have an infection that's so bad that it causes anything to burst within the inner ear. So otitis media is the other type of otitis that you need to be aware of. It is inflammation of the normally air-filled middle ear with the accumulation of fluid behind the tympanic membrane, which is your eardrum, occurring either unilaterally or bilaterally. So it can occur in either one ear or both ears. Otitis media is classified as either serous or suppurative according to the composition of the accumulating fluid. So they look at the fluid that is accumulating or building up in there, and then they make a determination of what type of fluid it is, and then that determines the diagnosis of what type of otitis media it is. So serous fluid is clear. It produces a feeling of fullness or pressure and kind of impacts the hearing. Suppurative is an infection. It will give you, it's usually green or like a yellowy color. It kind of smells. You can tell. If you've ever seen a kid with chronic ear infections, you have probably seen the green stuff oozing out of their ears, and you can smell it, and it's kind of gross. Definitely know when there's an infection in there. They will have fever, chills, nausea, vomiting. These type of infections or this type of discharge from their ear is the most common reason for visits to physicians for kids. Although it can be experienced by adults, most people outgrow these types of otitis media infections in their younger years. Meniere disease is a chronic disease of the inner ear that affects the labyrinth. It is marked by a recurring syndrome of vertigo, which is dizziness, tinnitus, which is ringing in the ears, a progressive hearing loss, and a sensation of fullness or of pressure in the ears. This disease process seems to involve a destruction of the tiny hair cells that are inside the cochlea for some reason, although nobody's really sure why. Predisposing factors for Meniere disease are middle ear infections, head trauma, dysfunction in the autonomic nervous system, noise pollution. So if somebody works in a very industrious or noisy background all of the time, then that can contribute to the development of Meniere disease. And then also premenstrual edema or premenstrual swelling. So that's it. That's the Chapter 5 key points. And if you have any questions, email me or you can comment in this week's discussion board post and let me know.